latest medical trends and hot topics.
Is your loved one the right one?
There's 12 different areas in the brain that light up.
And have your breasts changed with age? If you said yes, we have the answer.
I'm really excited to have the body that I used to have.
The Flash Recovery Breast Augmentation.
She just had it done this morning.
No pain, no recovery time.
Medical hot topics.
Today on The Doctors, we're changing every body, one body at a time.
We have a patient, Jasmine. She thought she was the perfect candidate for breast augmentation. Take a look.
I first started thinking about breast augmentation after my first child. And I really, really wanted it after I stopped breastfeeding my second child. I think that after you have a child, you lose a little bit of confidence. You look at yourself in the mirror every day and you notice that your body is just not the same.
Hi, Jasmine. How are you?
Good, thank you.
Good to see you.
Nice to meet you.
So I use a very quick recovery system. I call it the Flash Recovery. And most people go back to their normal daily routine the next day.
I picked Dr. Gavami because a friend of mine did a Flash Recovery breast augmentation and we were out shopping the next day.
I use a very precise measuring system. It's really going to tell me what size your skin stretch is going to be able to expand out to. So you're about 13.0 actually. And now one thing I'm going to do is feel the pinch thickness of your tissue. This side's even a little thicker. And then we'll measure the stretchability of your tissue here. So based on the measurements I did today, I think the size we talked about and the size you're shooting for is very achievable and realistic. And I don't think it's out of proportion. I think you're going to do very well.
And joining us in studio is Dr. Gavami, my colleague. Welcome. And what you have come up with is what you call your Flash Recovery Breast Augmentation. Tell us about that.
Well, the term flash is really kind of a tongue-in-cheek term that one of my patients came up with. But really, the gist of this, it's a recovery system that's quick and rapid, in essentially less than 24 hours. And I was lucky enough to learn it from one of my mentors, Dr. John Tebbets in Dallas.
My colleague, too.
Dr. Tebbets described it really in 2002, but a lot of surgeons weren't believing it and weren't catching on. They wanted to stick with their old ways of more kind of brutal, barbaric dissection techniques.
These don't look brutal and barbaric, do they? But you're absolutely right. That these are the dissectors that we used to use in pulling that tissue, separating the breast tissue from the chest wall and then inserting the implant. So what you're saying is you have now changed that you're doing your entire surgery with these two instruments, correct?
Exactly, yes. And so all those instruments do is really generate heat and cautery. And we've had that for years and years in surgery. But you know, a lot of surgeons don't know how to use it precisely in breast augmentation, and they tend to use one of the most dangerous instruments, which is really the finger. Going in there and dissecting and ripping muscle and shredding the tissue is going to cause injury and trauma to your chest wall. So obviously your recovery is not going to be smooth.
Well, what we didn't reveal yet is that Dr. Gavami actually just left the operating room a few hours ago after doing Jasmine's Flash Augmentation. Let's take a look at how the surgery went.
It's 6 o'clock in the morning and I'm on my way to the medical center to have my surgery done. I'm really nervous, but at the same time, I'm really excited to have the body that I used to have.
Hi, Jasmine. Good morning. And you're going to be heading back in a second, but I just need to go ahead and do some markings. Mark out the incision, mark out the borders of your breasts like we talked about. Flash recovery or quick recovery breast augmentation really requires that the tissue is handled very gently. So there's not a lot of bleeding, there's not a lot of pushing, pulling. There's no what's called blunt dissection. In other words, there's no tearing of tissue. By using heat cautery, you don't cause bleeding because blood equals pain. No blood. See that? No blood in the tubing. Okay, let me get the implant. This is a saline implant, has a little bit of saline in it. It should be able to squeeze in there fairly easily. The whole concept behind this is really to be, you know, the human body is sacred, and especially for an elective surgery, you want to really be safe, and you want the quality of life of the patient to not be affected. You want her to go back to her daily routines as soon as possible. Who wouldn't want that, you know? So there's no blood anywhere. Look at my gloves. So the operation was a success. It went quickly as expected, almost no bleeding, and you'll be able to see your results in about 2 hours.
We'll see the amazing results of Jasmine's flash recovery surgery later. Remember, she just had it done this morning. But first, are you taking these simple steps to keep your house safe for you and your family? Find out how to do it when we return. It's your health in the headlines today, and we have kept you waiting long enough. Just a few hours ago, Jasmine went into Dr. Gavami to get her breast done in what is coined the flash recovery breast augmentation. We have Dr. Gavami here, and true to the press, Jasmine, she's out of bed, she's walking around.
She has not taken any strong pain pills, like narcotic pain pills. Maybe she took ibuprofen. I didn't numb her breast pocket, and she's able to raise her hands up in the air right now.
What kind of anesthesia?
It was general with an LMA.
So she was asleep.
She was fully asleep.
But right now, she does not have like Marcaine or something long-acting.
There's no numbing. There's no camera tricks.
And this
It's only
was
been a
just
few hours.
earlier
To put this
today.
in perspective, when I learned to do this in the hospital as a resident back in the 80s, I mean, patients would be in the hospital for a couple days with breast augmentation. So
Now it's been a couple hours.
A lot of people do say on my way home, I stopped by, had lunch, I went out to dinner that night. The next day they go shopping with their friends. This shouldn't be something you lay in bed for and get wrapped with garments with pressure on them and drain tubes.
And for Jasmine, she doesn't get to go to dinner necessarily, but she does get to come on the show. Do you all want to meet her?
Yeah.
Jasmine, come on out.
Thank you. You look fantastic.
I feel great.
Yeah, you look like you feel great.
Yeah, it is.
It's hard to believe you're in the operating room.
I mean, we can't help but stare, right? I mean, that's what we're talking about.
No, but it made you feel so much better. I mean, because you said you felt different after breastfeeding, right?
Yes, I
and
did.
It's so normal for women. So, you know, and this is a good surgery for that.
And you had a couple kids, right?
Yeah, I have to.
So your breasts changed a little bit. You always wanted to be a little bit bigger, so the perfect candidate for breast enlargement.
Exactly. She had the perfect breast tissue. You know, she didn't need a lift because this doesn't necessarily work in people who need lifts. And it doesn't work in everyone, you know. There's certain people that it works for. And I'd say about 75% of my patients are able to recover this quickly.
I guess a limitation with this, her getting up this quickly, it'd be tougher with a much bigger implant.
Exactly.
Because
That's key. That's
because that does create pain as you're stretching the tissue. But as long as you stay with relatively small. And how long did it take you to do this?
Well, the surgery time from the moment I made the incision till I started closing, the implants were in, the dissection was done, was 17 minutes.
That is what?
That's
and
a
it's not a
flash.
race.
That's a
It's not a
flash.
race. What it,
Wow.
what
No,
it
it's
means
not a
is that
Less
It's
you've
just
done,
a
you've done something enough that you're that comfortable with it
Yes.
that it goes
Well, I was
smoothly.
lucky to train under Dr. Tebbets. He does the whole thing in 15 minutes. It took me 26, so I'm kind of slow compared to him. But, you know, the thing is that you're precise. You don't have to catch up and stop bleeders because there are no bleeders. And, you know, it's just a matter of treating the human body as it is, a sacred thing that we have, and not traumatizing it. And one thing that I have to show you, this is not a camera trick. Go ahead and raise your arms up in the air.
And the implants are below the muscle?
Under the muscle.
So this is subpectoral placement, which typically is very...
Causes pain. And a lot of people are just encouraged not to ever raise their arms. You know, they have to wear these tight compression wraps. With her, you know, she's going to go back into her surgical bra. She's just here for demonstration purposes. But they don't even have to wear the bra 24/7 necessarily because I'm not trying to control bleeding by compressing the breast. She's bloodless right now in there.
And let's show everyone really quickly your before picture. And incredibly, a few hours later, now.
Wow, that's fantastic.
And you're feeling good.
I'm feeling
Yeah.
great.
Well, you're a
You look
testament to it. You look
fantastic.
great.
Thank you.
Thank you for being here. Best of luck,
Thank you
Dr.
for having
Gavami.
me.
Thank you for
Very
joining
much.
us and explaining
Thank you, Jasmine.
surgery. Don't go away because medicine is about to meet fashion, and you don't want to miss it.